हेलो एवरीवन, वेलकम टू मेडसिनो। आई एम डॉक्टर रश और आज मैं डिस्कस करने वाला हूँ एक बहुत इंपॉर्टेंट टॉपिक जिसमें से यू विल डेफिनेटली गेट अ क्वेश्चन इन दी एफएमजी। ऑल्सो आई हैव अ क्वेश्चन फॉर यू एट द एंड, सो प्लीज़ वॉच द होल वीडियो। लेट्स बिगिन। सो आज का टॉपिक है की डिफरेंसेस बिटवीन एपिड्यूरल हीमाटोमा, सबड्यूरल हीमाटोमा एंड सब एरेक्नॉइड हेमरेज। सबसे पहले हम देखेंगे सीटी इमेजेस। अब epidural hematoma, we can see there is a biconvex opacity. For subdural hematoma, the opacity is crescent shaped, and subarachnoid hemorrhage will appear star shaped. Now for the location, we'll look at the names. So epidural hematoma, epidural means above the dura, so it will be between the skull and the dura mater. Subdural means below the dura, so it will be between the dura mater and the arachnoid mater. And subarachnoid hemorrhage, we can see according to the name, it will be in the subarachnoid space. Now the epidural hematoma, it does not cross the suture lines, but the subdural hematoma, it can cross the suture lines. The next important thing is source of bleed. The epidural hematoma, it is arterial in nature, and the most common cause is the middle meningeal artery. The subdural hematoma, it is due to rupture of the bridging veins, so it is a venous type of bleed. And the subarachnoid hemorrhage, it is due to the rupture of a berry aneurysm, and it is usually an arterial bleed. Now for the cause, the epidural hematoma is due to a trauma with skull fracture and usually the temporal bone. The subdural hematoma, it is due to an acceleration deceleration injury during a trauma. And the subarachnoid hemorrhage, as we discussed, it is due to the rupture of a berry aneurysm. Now lucid interval. Lucid interval is a unconscious trauma patient. He will regain consciousness and he will appear normal, but after that there will be rapid deterioration in his condition, and this is a classical feature of epidural hematoma, and it will not be present in the subdural or subarachnoid hemorrhage. It will be absent in those. And for treatment, the epidural hematoma will require an urgent surgical treatment. For subdural hematoma, will require a surgical treatment if the hematoma is large. Otherwise, we can do a conservative treatment. And for subarachnoid hemorrhage, the treatment will be the management of the cause and supportive care. That's all for the discussion. And about the question, so you have a trauma patient who is unconscious but his CT is normal. So please tell me, what would you suspect, and also the image modality or the investigation you will do to confirm your diagnosis. So please write your answers in the comments below, and thank you so much.